We're changing the world for children.
We're changing the world for soldiers coming home.
We're changing the world for families.
I am a social work student.
I am a fourth-year medical student.
I'm a student in the Pediatric Nurse Practitioner program.
So I'm a fourth-year student at the University of Maryland Dental School.
I'm a graduate student at the University of Maryland.
Next year, I'm going to be working as a judicial clerk for a judge in the Baltimore City Circuit Court.
The University of Maryland School of Pharmacy is going to prepare me very, very well.
This is something that not many people get the opportunity to do. To have this opportunity has just been amazing.
We're changing the world.
The University of Maryland is not only training people in their fields, but they're also teaching us how to ask questions like how and why.
Medical school and medicine in general teaches you to be a critical thinker, to always want to know more. We're always asking why and how to do things. How do things work?
Every day there are changes, every day there are new discoveries. So what they give us is that ability to be able to go and figure out and find all these information that you need in order to grow with the profession.
You know, we do train our students to be critical thinkers, and new drugs come out every day, so we have to train our students to critically evaluate, does this drug bring something important to the table?
And that's what pharmacists are, we're the drug experts. Hopefully, as we move forward into the future, these drugs, they're going to evolve, and so is our profession.
The professional landscapes that we're entering are continuously changing, but we're prepared for that.
How do you transform what you learned in medicine in 2012 to what you're going to be doing in medicine in 2035?
Students, through an interactive computer, will have access to radiology information, they'll have access to lecture materials, they'll have access to three-dimensional models, all at their fingertips.
What they're training us to do is take research and integrate it into our clinical practice.
I'm looking at a specific protein and its possible role in the aggressiveness of brain cancer. Research in molecular medicine is the future of therapeutics.
Nursing is always evolving and you have to keep up with it.
Every day, new changes, new research that's emerging that affects patient care.
With dental hygiene, with our faculty, they really are stressing us getting into research.
This room is called the Dream Room. It's a room where we dream about the future of dentistry, and the future of dentistry is now.
I think it's amazing. I mean, that's part of the reason why I applied to the dental school. And it was really very appealing to me as a future dentist to get the latest technology and to be educated in that, because I think that's the future of dentistry.
We're on the cutting edge.
We have realized that we can't be isolated in our own disciplines.
This year as a social work student, I've had the opportunity to work with pharmacy and medical students to impact legislation related to public health and healthcare policy.
Medicine doesn't just involve medicine, you know. It does involve information technology. There is a medical legal aspect of it. There is social work involved in it.
You know, we have to be a team. We have to work with doctors. We have to work with nurses.
When the nurses and the doctors and the pharmacists work together, it makes for a better therapy. We all have to work together.
I think we're changing the world at the University of Maryland one student at a time, and I'm proud that we're doing it in an interprofessional manner.
When we graduate, some of us will work locally, some of us will work for the public sector, some of us will work for private firms throughout the country, and others of us will even work for international firms around the world.
One of our major initiatives is to improve the healthcare and healthcare access for the members of underrepresented minorities in the surrounding communities.
We engage community members and all kinds of stakeholders to impact public policy to improve the lives of low-income communities.
I worked at the Maryland Legal Aid Bureau and was able to help citizens of Baltimore City.
I had the amazing experience of being able to go to Nigeria through the Institute of Human Virology. I wanted to do something that was a universal service, something that I could do anywhere in the world at any time and help anyone.
Some of the emerging legal challenges today are
Healthcare access,
right to counsel,
reproductive rights,
religious freedom.
Because we have been trained by the best, we know that we ourselves will be the ones who will have a chance to make a difference.
Research in molecular medicine will change the world. The things that we discover have the potential of transforming cancer treatment.
How am I going to change the world? Hopefully just taking care of one patient at a time.
I think that the foundation for change lies with our younger generations, and the knowledge and the experiences that I'm receiving here, using that to lead them towards a greater future is, I think, the key to changing the world.
Social workers' understanding of poverty at the ground level is critical to addressing social policy concerns. And my training in social work has given me that understanding.
What we do is we look out for the underserved.
Well, I have a passion for public health. I'm hoping that if I can take a top-down approach to helping solve some of the health crises that America faces, then I would be very satisfied.
With my training and support from the faculty at the School of Law, I was able to acquire a clerkship from the Chief Judge of one of Maryland's appellate courts, and I am very pleased with the results of my education.
Feels great.
Making a difference is important because we have to keep hope in our ability to change and our ability to grow and improve.
I hope to change the world by building stronger communities and bringing everybody together.